Hi, guys, and welcome back to the Drama Free Healthy Living podcast. I'm your host, Jess Cording. I'm really excited for today's episode. We are talking all about women's health. And specifically, I am chatting with members of the Evvy team. So I am chatting with Priyanka Jain, who is the co-founder and CEO of leading women's health platform Evvy, as well as Evvy's first lead medical director, Kate McLean. So a little bit about Evvy. So Priyanka founded Evvy with a mission of closing the gender health data gap. So by discovering and leveraging overlooked female biomarkers, starting with the vaginal microbiome. So in this episode, we get all into, how these types of tests work, what they're looking at, what types of treatments can help address some really commonly underdiagnosed issues. We talk about disparities in women's healthcare. We get into a lot of really fascinating stuff and just about, what we might be doing, what we could do better, as healthcare providers, how the healthcare system might better support women, the reasons it's so important to advocate for yourself and how to do that. This is a topic that is near and dear to my heart. I'm really excited to chat with these ladies today. I hope you like this episode. So yeah, enough of me talking. Let's get to the episode. Welcome to Drama Free Healthy Living with Jess Cording. I'm your host, Jess Cording. I'm a registered dietitian, health coach, and author, and I'm here to help you streamline your wellness routine and establish a sane, more balanced relationship with food and fitness so you can reach your goals without losing your mind. On this podcast, we'll talk about nutrition, exercise, self-care, mindset, and more. I'll be bringing you interviews and expert insight on the topics that matter to your health and wellness. So, Kate and Priyanka, welcome to the podcast. It's so nice to have you both here.
Thank you so much for having us. We're very excited to be here.
Yeah, I was really excited for this conversation because I love how there's so much, we're seeing so much innovation in women's healthcare, especially on the tech side and just integrating different tools and making them more approachable. And I think Evvy is fascinating, super, super cool. So I was really excited to talk to you both.
Well, we feel the same way about the amazing work you're doing.
Thank you. And I wanted to spend a little time today, just kind of start off, because I feel like in this field, a lot of us find our way here because it's something we feel strongly about. We've been affected by it or we've seen our loved ones, have to deal with this. And I was hoping we could chat a little bit about disparities in women's healthcare. I'm going to try not to roll my eyes, but we'll see how I do. But I would love to hear, from your perspective in the field, what are some of the ways that you have seen that women are underserved in our healthcare system?
For sure. I can start from kind of a patient and founder perspective. And then Kate, please feel free to add from the provider perspective as well. But I think I think as a woman who has been a patient of the healthcare system, I always joke like one too many times, which is why I had to start Evvy. I think you can feel the many ways that our healthcare system has not prioritized us, right? And I think the one that I am the most fascinated by and frankly frustrated by is the fact that women weren't required in or really even allowed in clinical research in the United States until 1993. And that to this day, women are diagnosed on average 4 years later than men across over 700 of the same diseases. And that is incredibly frustrating because obviously when we go to the doctor, what we want is the ability to get the right diagnosis, get a treatment that works, and go back to work, right? But unfortunately, we're met with a healthcare system that doesn't really understand what health and disease looks like when the person that we're talking about has a female body, right? If you think about it historically, we essentially studied middle-aged, mid-sized white men. We made the ranges smaller for whatever was predictive of health and disease in those people. And then we assumed we had healthcare for women, right? And I think what we really are focused on at Evvy is this idea that the female body has so many unique biomarkers, right? So many signals that it's trying to tell us where things are going well and where we need help. But we're just not measuring or tracking any of those signals because we don't realize that they're predictive of health and disease because we never studied women. And so I think as someone with a background in data science and machine learning, I'm really frustrated by the lack of data and then how that manifests in the experiences that we have at the doctor's office where we can't get the right diagnosis and treatment because we never study women. But Kate, I'm curious what you would say from your perspective as well.
So I think as a provider, having worked with patients for many years, One of the things that I find most frustrating is that we know from data that it takes women more visits with providers to convince them to take their pain seriously, to do a workup in order to move towards a diagnosis than it does for the same male patients. So when you place that bias against women and their experiences with their bodies and their experiences with pain and discomfort, and it intersects with a lack of research and a lack of data, then this is where like a lot of danger lies. And I'll dovetail this a little bit into what Evvy does. Take vaginitis and vaginal infections as an example. It's one of the most common reasons that patients with vaginas go to the doctor. And it's also really commonly misdiagnosed. And so I think there are a lot of patients who feel kind of helpless in the face of the traditional healthcare system when dealing with something like vaginitis because their discomfort and their symptoms have kind of been minimized by the traditional healthcare system. And then because, we as a medical professional group have not made as much progress in this arena either. And people remain misdiagnosed, even if, say, their doctor does take them seriously and does perform a series of tests. Your average test leaves a really high probability of misdiagnosis. And then this poor patient is still just dealing with the same old symptoms. And this is, I think, one of the things that's really motivated us at Evvy to try to make changes in this arena.
Thank you so much for sharing that. And I know from being on the patient side of it and also having been a provider who's trying to care for women who, they don't have all the information that maybe they need to get the best care. It's really frustrating. And I also am struck by, again, just conversations with my patients and my clients, experiences I myself have had, but just, common barriers to care that women face. And I'd love to hear from your perspective, what some of those are, from the work that you guys have done.
Totally. I can talk about from when I was thinking about, where are the biggest opportunities for us to make an impact in women's health. I think that what you see is there's almost three buckets, right? One is how do we increase access to care, right? There's just generally barriers to access that are either geographical, right? I think it's something like 50% of counties in the US do not have an OBGYN. So there's geographical barriers, there might be language barriers, there might be cost barriers, but all of those to me kind of go under access. How do I get access to care? The second one is how do I have a better experience when I am seeking care, right? So to what Kate was saying, is my doctor listening to me, right? Am I in a place that takes me seriously? And here's the problems that I'm having. And then the third bucket, which is I think where Evvy is really focused, is how do we actually innovate on the standard of care that is actually delivered through those more accessible and better experiences, right? How do we actually make sure that there are diagnostics and treatments that are available for the symptoms that we have? And so all that to say, essentially there are barriers everywhere in women's health. And maybe the last one that I'll mention is really also on the funding side, which I think that part of the reason that there are so many barriers to access, to experience, to improve standard of care is because simply there is not funding, right? And I mean funding from a federal level, from a private standpoint. I think on a federal level, 4% of the US healthcare R&D budget goes to women's health. On an international global level, when you look at private dollars, I think it's 1% of global R&D dollars go to women's health. And then when you look at it from a private venture lens, it's something like 3% of digital health investment dollars have gone to women's health. So when you think about that, how are we supposed to make an impact on these massive problems that are affecting 50% of the population with 1, 3, 4% of the dollars? It's just not going to move the needle.
Mm-hmm. And it means that this really common condition like vaginal infections or vaginitis, which despite the fact that so many people struggle with this, because there's been this lack of funding dollars and resources, it means that the expertise in something like this is very concentrated. So there are so few experts in this condition, and they tend to be in major metropolitan areas. And it can be really, really difficult, not just to access good women's healthcare, but if you want like a vaginitis expert to help you, it's almost impossible. Even if you live, I'm from Seattle, even if you live in Seattle and you have great insurance or you're willing to pay cash, you're still probably looking at a wait list of 6 months plus. And that's in Seattle. I mean, imagine if you live in a rural area. And so to piggyback on what Priyanka was saying, I think the amazing thing that Evvy is also able to do is to not just increase access to like basic women's healthcare, but to increase access to this very particular expertise, because really it shouldn't be this particular expertise. It's such a common need. And so we're connecting those dots in a way that feels really meaningful to me.
Yeah. And what are some other, and because I know from my work with clients, there's a few like on my list, but like, what are some other examples of some pretty common issues and conditions that go untreated or even like undiagnosed just due to these barriers of care?
Oh gosh, there's a long list. I mean, things that come to mind for me are like pelvic floor physical therapy as being one. Certainly after childbirth or when entering menopause, this is something that many people with vaginas experience. And similarly, there are very few pelvic floor physical therapy experts. And again, it kind of intersects with this area similar to vaginitis, where I think that women have been shamed for having this type of symptomatology. Oh, it's all in your head. If you lost weight, if you exercised appropriately, like you wouldn't need me to deal with this for you. And it kind of falls into that same general category. And I think that's one of the reasons maybe it hasn't gotten as much attention. I'm sure, Priyanka, you have in your mind a long list beyond pelvic floor PT.
I mean, the list is so long. I think even just to double click quickly on vaginal health, because I think it so often gets left out when you look at lists of conditions that affect women. Actually, vaginal discomfort is the leading reason that women seek healthcare advice in the United States. So if you are somebody listening to this who has dealt with recurrent yeast infections, recurrent UTIs, BV, and you feel like alone or frustrated on that journey, I think even though it rarely makes the list of important women's health conditions, it is actually the most prevalent. It is the number one type of OBGYN appointment. I think it's something like 30% of women at any given time have bacterial vaginosis, which is just one of the many vaginal infections that you could have. And when we go to the doctor, we are more likely to be misdiagnosed than correctly diagnosed. And we are more likely not to get better than we are to get better. So I think that is just completely unacceptable and unbelievable to me how little we talk about it. And I think to Kate's point, it's one of those conditions where since we don't have great tools, people are like, you're probably fine. And I don't really know what to do. And you have this issue of maybe it's in your head or there is no expert to go to. And then it affects you physically, emotionally, relationally, you name it. So obviously, I feel very passionate about that one. But I think other ones that I would add to the list are obviously conditions like endometriosis. I think the average time to diagnosis is 7 to 10 years. The only diagnostic accepted is a surgery, and then treatment is surgery. So I think we could do much better there. Another one that comes to mind is PCOS, another condition that is poorly diagnosed and poorly treated.
Takes like 2 or 3 years and multiple providers to diagnose usually.
Insane. And I think something that all of these conditions have in common is that they are so broadly defined that it's actually very difficult to have effective diagnostics and treatments. And what I mean by that is one of our advisors says something that I repeat now all the time, which is that cancer is an unsolvable disease. Lung cancer, still an unsolvable disease. But when you get to the specific mutation of the specific gene, that becomes a solvable problem, right? Something you can focus your efforts on, detecting or treating. And I think the challenge in women's health is take things like vaginitis, PCOS, endometriosis. These are all so broadly defined and not well stratified that it becomes almost impossible to find a single diagnostic marker or a single treatment. And so then women are left with no diagnostics and no treatments because we don't gather the data to accurately stratify them into more specific cohorts. And so I really think that data is a key missing part of so many of these conditions that we suffer with. And we really hope that changes over the next few years.
And there are signs of hope too. So I think about perimenopause and menopause, for example. I mean, back when I went through training, everybody thought that hormone replacement therapy for menopause was dangerous and, you really shouldn't prescribe it to people. And now that we understand the data better and there's additional data, we now know that that's not accurate. And for many years, it was the same issue that I described with pelvic floor PT. Even if you lived in Seattle and even if you came from means, it was very difficult to connect with a perimenopausal or menopause expert. But there has encouragingly been an infusion of dollars into the menopause space. There are startups that are taking this on, and they are starting to bring this expert, like this very particular expertise, to more rural areas in a little bit of the same way that Evvy is doing for vaginitis. And so there are these signs of hope. People are talking about perimenopause and menopause more. More doctors know what to do. There are these startups filling in the gaps, and you're really seeing movement. Even when I talk to my fellow doctors or other friends, they're saying, oh, I'm having such success treating my patients now, or I myself personally am feeling a lot better now. And it's just amazing to see that trajectory. And I think Evvy is forging that path in a similar way.
And I mean, I love that, like, to echo what you were saying, Priyanka, like, data is so powerful. And I think when people who utilize these different types of services where they're connected with their data, when they can kind of see changes over time and they can see how treatments impact different biomarkers, like, or they can see how diet and lifestyle changes impact certain things, like, that is so powerful. And ways of making it more accessible, like, so someone doesn't have to live in a metropolitan area, is really incredible. But we've been talking a little bit about it, but I would love for you guys, tell us a little bit more just about Evvy and how the company was started and just sort of what you guys are doing to address these disparities and connect women with the care that they need.
Absolutely. Well, I feel like I've talked a lot about vaginitis and how prevalent the condition is. And I mean, at the beginning of this, we were talking about overlooked female biomarkers. And that is very much our focus at Evvy, is paying attention and studying these unique markers that the female body is giving off so that we can leverage them to improve our ability to predict risk of disease, diagnose disease, or treat disease as it uniquely manifests in women. And obviously, our first focus and our obsession is with the vaginal microbiome. And I think there's kind of two interesting things to know. One is what I was mentioning earlier about how prevalent and frustrating these conditions are, right? Leading reason women go to the doctor, more likely to be misdiagnosed and not get better than the opposite. That is an insane set of stats to put together. On the other side of the vaginal microbiome, there's so much research that shows that what's happening in the vaginal microbiome is not only the cause of these symptoms and infections that drive us to the doctor, but it's also playing this huge role in so many other women's health outcomes. Everything from IVF success rates to preterm birth rates to cervical cancer progression rates to STI acquisition. And it's just mind-blowing to me that for the leading reason women go to the doctor, or for all of these conditions that are frankly negatively impact our health and cost our healthcare system so much money, how are we not using data on the vaginal microbiome to improve outcomes in these areas? And so that's very much what we set out to change. We brought shotgun metagenomic sequencing, which is a fancy way of saying testing all the bacteria and fungi in a sample, to an at-home swab. So patients can come to Evvy no matter where they live in the United States, order a test, take a swab themselves at home, and get the most comprehensive, validated testing of their vaginal health, learn about this part of their body that unfortunately we have not been well educated on to date, and then actually connect with expert providers who can help prescribe personalized treatment programs based on Evvy's dataset, which is actually now the world's largest and most comprehensive dataset ever on the vaginal microbiome. And finally, access precision healthcare for vaginal health in a way that they've never been able to access before.
And I have to say, I had the opportunity to meet with a couple of your health coaches, and they're fabulous, by the way. Like,
Oh,
I'm like the worst patient ever because I have such high standards for myself as a provider that like I always am hoping for like really like top notch, like engaged like care from like a provider, especially if we're talking about like women's health. And I was so blown away, just personal, personal thing. Like
that's so
I
sweet.
was so happy to see that.
Well, that is Kate's team, and I'm sure she will take it back to her team. So we're so
I
happy to hear.
will. Thank you. They're going to love hearing that. We really do take pride in our coaches. They're truly amazing. They care so much and they have such extensive knowledge bases about all of this.
Oh my gosh. I was so impressed. And it's kind of sad that like when we like I count myself and it's like so many women we go to the doctor, even at the GYN, and we're kind of not expecting much because we're so used to just being like my gynecologist, she doesn't even know my name. Like I've been going to her for years. Every time I see her, she's like, "Nice to meet you." Or like, "I'm Dr. I'm like, "Okay, all right." But then there's other people in that office who are like phenomenal. But I remember the first time I met with someone there who was one of the nurse practitioners, I was just, I wasn't expecting much because of my previous experience, but she had all this knowledge and she was like talking with me about all my labs. And I was like, thank you. Like you care. You're amazing. This is great.
We've
But yeah,
all been there.
yeah,
We're a
yeah,
team of ex-patients or
right?
current patients. We're all current patients, and we're all like, what is the experience we wish we had?
Yes. And you can tell that the people on the team like are really coming from that place. It's really, really special.
Thank you for saying that.
Now, could you tell us a little bit about what like some of the types of biomarkers are being looked at on the Evvy tests?
Absolutely. So, like I said, we're sequencing the whole genome of all the bacteria and fungi in the sample. What that means is that we're able to give patients a really comprehensive understanding of everything happening in their vagina, right? When you go to the doctor today, the gold standard is still literally smelling swabs and counting shapes under the microscope and trying to guess what's happening. Maybe if you're lucky, you'll get a PCR test that looks for 3 things or 5 things. What Evvy is doing is it's saying, what is everything present in this sample? How much of it is there? How active is it? What is it doing? And what that allows us to do is help patients understand, is your vaginal microbiome dominated by protective bacteria that are serving this really important immune function for your reproductive system? When it is dominated by that healthy bacteria, those bacteria are producing lactic acid and hydrogen peroxide. They're taking up space on the vaginal wall so that when pathogens inevitably get into your vagina, they can't survive. They can't thrive. It's too acidic. There's no space for them, right? You want to know, am I dominated by those guys or not? If you have symptoms, then you want to know, what are the pathogens in my vaginal microbiome? How much of the vaginal microbiome are they taking up? What is the best way to treat them? How are they interacting with the other guys? And so what Evvy is doing is giving you this full comprehensive picture of overall, what type of community do you have? And then also specifically, what is causing potential symptoms or what might be affecting your health goals, like getting pregnant? And then what can you actually do about it? So every single test comes with, I'm sure you've seen this, a plan of step-by-step next steps that you can take to your own doctor. Or you can also work with Evvy providers to get those custom compounded vaginal suppositories with the exact ingredients that we predict are most likely to help you. And Kate, I don't know if you have anything to add to that also.
Well, Jess, I'm wondering if you were asking also about like the unique biomarker sort of association. And so we could also talk a little bit about that if you were also interested in that aspect. So there are particular strains of bacteria that are linked to certain health outcomes. So bacterial vaginosis microbes like Gardnerella, Prevotella, there's a long list of them, for example, have been associated with preterm birth. And preterm birth is a condition that's not fully understood. We definitely need more research. But there is this thought that potential infectious etiology or inflammatory etiology could be contributing. So if the microbiome in the vagina gets disrupted, and of course, the vaginal microbiome is not in a vacuum by itself. It's attached to the cervix, which is attached to the uterus. And if somebody is pregnant, their bag of water is sitting right there. It's exposed to the microbes that are in the vagina potentially. And so understanding how we can impact that. So what particular microbes, what particular even genes or gene activation within those microbes might put somebody at risk is super interesting to take a look at. And what's also really interesting, and this builds on what Priyanka was saying about us having the largest data set on the vaginal microbiome in the world, is we also have had lots of patients who have come to us and tested, have gone through treatment regimens with us, and then have tested again. And so what's exciting is that I can look at hundreds and sometimes thousands of patients in these situations. And what I know is that our treatments with Evvy actually make a dent in these same markers. So not only can we maybe look and see which are the players that are causing these problems potentially, but I already have data that says, well, if it's this species of Gardnerella, I already know that our treatment program is able to reduce that species of Gardnerella by X%. And so that's what gets me really excited, because it's one thing to be able to predict something. And in preterm birth, there are other measures you can potentially take to help reduce risk. But for us to say, we actually know how to get that particular bad guy, and we know that we do it well. Like that's a super satisfying path to be able to take as we're exploring these things.
So actually, you bring up a really good question, a really good point. If somebody were to do a test like this, and it sounds like possibly like before someone's trying to get pregnant might actually be a great time to kind of check in. Because I do work a lot with women in the fertility space, and I'm that's just sales for me. But I get a lot of questions about things that people should be doing to optimize their fertility and like kind of get everything checked out. Like, is there like an ideal time before someone's like trying to conceive that you recommend they like explore this stuff if they're worried about there being any kind of issue, or they just want to make sure that everything looks good?
Such a great question. Evvy is launching fertility-specific insights within the Evvy product and platforms. We've essentially taken all of the research that's been done on the vaginal microbiome and fertility outcomes. And for every patient who's interested in fertility in the vaginal microbiome, we can actually create a full new set of insights that shows you how what we found in your vaginal microbiome can be associated with various fertility outcomes. And then what you can do to optimize those markers, to Kate's point, so that you can maximize the chances that your vaginal microbiome is working in your favor for that goal that you have. And so we're really excited to kind of bring our expertise in the vaginal microbiome to helping this set of patients that many of them have read the research. Many of them know that there is this relationship, but until now, they've never been able to actually directly test for it. So we're really excited to offer that.
That's very cool.
Yeah, there's this pretty strong body of literature that links certain markers in the vaginal microbiome to these fertility outcomes, whether that's infertility of unknown cause or whether that's successive IVF treatments. But these testing methods are oftentimes only available in a research setting. They've never been widely available to the public. And so it's really lovely for us to be able to step into that space and help provide these insights for folks and then next steps as well.
Very cool. That's exciting. I'm excited to be able to share that with people.
Same.
I wanted to ask a little bit, we're talking about Evvy and the technology platform and all the things that you guys are doing to connect women to these resources. I'd love to hear your thoughts about just more broadly, like, what are some ways that, the healthcare industry in general, like whether that's providers or more on like a systemic level, like what might help better support women? Like what should we be paying attention to, or what would make a difference in your thoughts?
Such a good question. I mean, I have a lot of feedback for the healthcare system, if that's where we're going. I mean, one thing I would say is that reimbursement is a huge issue in women's health. The lack of reimbursement for women's healthcare services, the differences between the amount we reimburse for procedures done on women versus men. So we are literally disincentivizing doctors from providing women's healthcare, which I think is just mind-blowing. So that's a large challenge. I think many of us in the industry are really focused on how do we change the paradigm as it relates to reimbursement for women's health, because that will help move the dollars, and moving the dollars always moves everything else. So that's one. I think on the industry side, really, I think so much of it is listening to women. I think as if you're a company that is providing care in any way, I think it's saying, women are probably the experts on their own bodies. If they feel like something is wrong, they are probably right, even if you don't have the exact tools to validate that. So I really feel like we can be so much further as an industry if we just listen to women. And then my hope is that we put more data behind the lived experiences that so many women have, right? Women feel like, I feel XYZ, so I do ABC. But there's no data to support that because no one studied it. So how do we actually start to study the things that women have done for generations so that we can have the data to say, we know this works or it doesn't work? So I think listening to women and gathering data are going to be two large things that hopefully our industry can push forward.
Amazing.
Yeah. And I would love to just encourage the healthcare system, as you say, to be more open-minded to, like what you were saying, Priyanka, to really listening to what women are saying that they need. But then also as you were saying, Priyanka, women are kind of trying to innovate on their own. And many times when they bring that into the traditional healthcare system, they just get completely shut down. Like this, what you're describing to me, these test results you're bringing to me, what you're saying you would like to do doesn't fit within my usual framework. I don't know how to help you. Like, I don't know why you're so worried about this. And I say this with love. I am an OBGYN. And I say this with the understanding that the traditional healthcare workforce is really burned out right now. They are having to see lots of patients with very tiny time slots, and they're not necessarily getting well reimbursed. And they're getting forced to do more with less. After the pandemic, which I think was honestly really traumatizing for a lot of providers, people are really burned out. And so I understand why it's so hard to give the patient the benefit of the doubt, why it's so hard to say, I'm going to try to make room in my day to learn about this new innovation that this patient is bringing to me, and to bring that compassion and say, well, this patient wouldn't be bothering me about this unless what we'd already done for this person wasn't working. And so, let's talk about what might actually work for this patient. Let's be curious. But that takes time, and it takes energy, and it takes compassion from a workforce that is just completely depleted. And so it's just a tough place to be. But I would love for us to try to work to a better spot with that.
No, you're to your point, the burnout in physicians and other care providers is huge, and that has such a trickle down effect. And because it's what, I think what often happens is that like an organization might be like, oh, we're providing burnout resources. We host webinars once a quarter, but then the providers can't go to the webinars. Or if they're running like a 8-week program, but it's like during lunch when that providers are being scheduled to see patients, it's like it's a whole, almost like a cycle, right? Because if the provider's burned out, they can't provide good quality care, and then end up with more people who are sick getting into the system, not getting care. It's such a mess.
Right. There really is this trickle down effect. And many times the support, and I say that kind of with quotes, that's provided by the medical system is a kind of a joke, when really what providers need is better schedules, longer
Mhm.
appointments with patients, more ancillary support in clinic. They need time off and support when a traumatic event happens, say in the operating room or on the ward, when there's a loss or there's an error. There needs to be tort reforms such that people are not living in fear of some kind of lawsuit for their entire career. In OBGYN, that's a particular problem because litigation rates are so high in this space. And so there's so much that could potentially be done to better support this workforce that just isn't. And then it leaves the providers in a place where they just don't have the capacity to meet patients where they are. And this is one of the reasons that, I mean, honestly, that Evvy has had this space to step into, is because providers just don't have the capacity to try to be investigators when it comes to people's vaginal microbiomes or infections or these other biomarkers. And it's understandable why. And we hope that we can be here to help.
And I'd love to hear your thoughts coming back to this idea that women are the experts on their own bodies. If someone out there listening to this, maybe she's experiencing symptoms or suspects that she has an underlying condition and just is not sure how to get the support and the care that she needs. Like, do you have any advice that you would give her?
Oh, well, first, you're not alone. I think that that's most of my friends, that's most women I know feel like there's something going on that they can't figure out with their bodies and their health. I would say two things. I think one is try to get as much data on your body as you can. Go to as many of the services that will help you access novel types of testing, comprehensive types of testing. Like the only way to figure out what's going on is to have data that helps you point to where issues are. So then you can point to potential solutions. And then I think two is you can't be resigned to having a provider that won't listen to you. I think we heard from Kate, so many reasons why providers are not always in a place to be the best provider for you, but that doesn't mean that you don't deserve amazing care and you don't deserve somebody who will listen to you. So I think it's just keep looking and ask your friends for a provider who listened to them or who helped them, because I think getting the right data and finding the right partner to help you work through that data and figure out what's next are the most important things. And there are great tools out there. Evvy is one of many. And there are great providers out there, right? And I think finding those two things will set you on your way. And I think you just can't let somebody tell you it's in your head.
Right. It's like advocating for oneself and really trying to communicate as best you can. That's really going to give you a leg up. And I say that acknowledging that it is a privilege to be able to do that. You know, if you're working 3 jobs and, you're waiting for the bus that never comes and you've got 2 kids in diapers at home, it's going to be almost impossible to do that. So acknowledging that for some people, it's incredibly difficult. And I wish that there was a good answer for that. We have to acknowledge that for some folks, there is not a perfect answer. I wish that there were more support services that made good care accessible to everybody. And, that's a mission that's close to my heart.
And the only other thing I'll add is that I do think that one of the things that we can do as patients that make it easier for providers is to do as much education as we can before we go to the appointment. One of the things we talk about all the time at Evvy is like, we're going to give you all of these results. We're going to show you all of the research. We're going to give you so much information. And then we're going to partner you with a health coach like you experienced to really walk you through it, to answer your questions so that by the time you get to the doctor, you're not saying, what is this and what does it mean? Instead, you're saying, okay, these are my 3 options. Can we talk about which one is the best for me based on my personal medical history? And then you can participate in what we always talk about as shared decision making, right? And I think so much of the challenge is doctors don't have time to both educate you and participate in shared decision making. So what happens is they're answering your questions and then they're just making the decisions for you. And maybe that decision doesn't fit into your life for one of many, many reasons. So I think the more you can do to be educated up front, use tools like Evvy to learn about your body, have people who have the time to answer your questions, then you can use that 10 minutes that you have with the doctor to be a part of the conversation about what you're going to do about it.
Yeah, I love that. Thank you for sharing that. Because, yeah, if I had a nickel for every time someone has said to me their doctor told, and I've experienced this too, they're like, just go back on the pill. Like, no,
I
that's not the right answer for everybody. But yeah, I love what you said about just coming with information. I'm that person. I will write the list of all the labs that I want or like all the things that like I said, I am probably not anyone's favorite patient because I always have like a million things on my list. But I think it is important to advocate for yourself and to know yourself and to do your research and not to the point, I think there's that line, right, between like being informed on your body and then showing up and being like, well, I saw this thing on TikTok and, it must be true. So there's, I understand there's definitely that can be a thing. But yeah, just knowing yourself and knowing what you need and asking for it is really, really powerful.
Amen.
And just knowing that this is something that everybody struggles with. I mean, I approach this from probably like one of the most privileged places when accessing the healthcare system. And even I, in like the last year, have had my primary care provider minimize a test result and tell me that nothing needed to be done when I went to an expert, like was horrified and put me on medication to treat it immediately. So it's like, even I run into this when I'm really knowledgeable and sophisticated and in theory I'm seeing good providers. And so this is really difficult for people. And it is an uphill battle, but certainly a worthwhile one.
So if people want to learn more about Evvy, check it out, connect with you guys, what is the best way for them to do that?
Yes, we are on Instagram at Evvy and on TikTok at EvvyBio. I strongly recommend following, regardless of whether you buy the test or you're interested in your vaginal health. Our content is phenomenal. It's just women's health education that we all deserve. Science and medically reviewed that answer the main questions that women have about their health. It's also incredibly funny. So I highly recommend following along for the content and the journey. And then if you are interested in your vaginal health, you can check us out at evvy.com. It's EVVY.com. And you can access our vaginal health test directly from there. And then our providers will be able to help you with the test, help you with treatment so that you can get to the best version of yourself.
Amazing. So I have one last question for each of you. This is a question I ask all my guests on this show. And I understand that the answer can change day to day, but today, this moment in time, what does healthy living mean to each of you?
So I guess what it means to me is really having the opportunity, the tools, the access to, when I decide what my own priorities are for myself in my health, to be able to focus on those things and to answer them. Like that's what healthy living is. It's like, it's not the system telling you what your goals should be or what you should be focused on, I don't think. It should be you having the information, the informed shared decision-making to say, here are the things that are important to me in my own personal health. And then having the system meet you there. Like that's what healthy living means to me. Like the system meets you and says, okay, I see that your goals are this, this, and this. And we have the resources to support you in those goals in such and such way. And that is just not the way the system is currently designed. The system is currently designed as top down to be like the things you should be worried about as a woman is your pap smear and your mammogram. And those things are important, but people have health goals beyond that. And so to me, healthy living means having a system that supports people's own pursuit of their health goals.
Thanks for sharing that. I love that so much.
I love that also. I was going to say on a little bit, maybe a personal note, is I feel like for me, it's like, how do I just do what I can, whether it's on a daily level, a weekly level, a monthly level? Like, what are the commitments I can make to myself that I know make me feel better, right? Like being the CEO of a company is a lot, right? So it's like, okay, what are the things I know I need to do every day that make me feel better? What are the things I need to do every week or every month or every year? And I think just keeping those commitments to yourself and knowing like, okay, I can't do everything all the time because that's just not where I am in my life right now. But like right now, this is what being healthy feels like to me. And I just need to meet those commitments. And then I think the other thing that really helps me, which is probably unsurprising given I started Evvy, but I like am obsessed with data on my own body, obviously. Like I wear the Oura ring, I wear the Apple Watch, I obviously use my Evvy test and I do blood testing. And I just want to make sure I know what's happening in my body so that I'm able to prioritize when I need to help something, right? I think I try to just keep my daily commitments and then I'm like, okay, now I need to put extra effort here or I can move my effort here. So I think by just like tracking the data and then doing the things that you can do, it helps me feel like I'm doing right by myself, even when I feel very busy.
Amazing. Thank you so much for sharing that. I love that, again, so many different ways to interpret that question. And it's personal, it can be broader. I love it. And yeah, I love all the data. When I was on my fertility journey, there was a time I had to rein it in. I was using 5 different fertility tracking apps at once. I was just like, I like had a moment where I was like, what are you doing? This is not helpful. Like I have like even, with data, I've had to find like a sweet spot for myself. Like these are the things that I need to know right now. And then blood work here and there, but it's like but it's pretty cool. There is so many more tools now to learn. I'm so excited to see as time goes on, like what tools will continue to be developed to support, not just women's health, but health in general, and really empower people to get to know their bodies and to know how to take care of them.
I totally, totally agree.
Yeah, well, thank you both for being here today. I love getting to talk about this stuff, so I was so excited you could be here. Thank you for making time.
Thank you so much for having us and for the amazing platform that you've put together to give so many women a voice and to feel heard. It's really incredible. So thank you so much.
Yeah, thank you.
That means a lot. And all you guys who are out there listening, as always, I so appreciate you being here. We could not do the show without you. If you like what you hear, please consider leaving us a 5-star review on Apple Podcasts. They do matter, and they help me continue to bring you great guests. So as always, guys, like, share, subscribe. You want to follow along, sign up for my Substack, jesscording.substack.com. I send out a newsletter every week. Have a wonderful day, guys, and we'll talk soon. Thank you for listening to Drama-Free Healthy Living with Jess Cording. We'll see you next time. And just one more thing. I may be a dietitian, but I'm not your dietitian. The information in this podcast is meant for educational purposes only and is not intended to diagnose or treat any medical condition. It is also not a replacement for individual counseling. Always check with your healthcare provider for questions related to your own health and well-being.